Giselle, for reasons which are still not perfectly clear, developed a massive blood clot in the veins of her lower left leg. And it brewed for a couple of days until her left leg became very, very swollen. And in fact, so swollen that it was compromising the blood supply to her leg. And she came to our hospital, and in an attempt to start treating her for that and try to improve the blood supply to her leg, during that time, a massive amount of the blood clot embolized to her lungs, causing her heart to fail and almost causing her heart basically to stop. She almost died. The response among the cardiac cath lab staff was immediate and kept her alive. When she came to the cath lab after they were trying to help the circulation in the legs is when the embolism took place to the lungs, which caused the heart to stop. Literally, within a minute or two, that was recognized, and cardiopulmonary resuscitation, CPR, was initiated immediately. And in our lab at Newark, Beth, Israel, we have the capacity to initiate ECMO. ECMO means that we put tubes in your arteries and your veins, and we take over your circulation because your heart or your lungs are impaired. So literally within minutes, the process of taking over her circulation for her was undertaken very successfully by our colleague, Dr. Beth. And by doing that, we kept her alive long enough to then go to the next step, which was to dissolve the clots that had obstructed her lungs almost entirely, both lungs. And because of the fact that we have so many different teams, the team that took care of the ECMO, the team that took care of the vascular compartment and surgery, the team that took care of the ECOS, the amazing work done by the intensive care unit nurses in the pediatric ICU. Because we have all these teams that complement each other, we were able to take care of her from A to Z, in spite of the COVID pandemic.